So the most recent numbers here in East Baton Rouge Parish, we have had 98 East Baton Rouge Parish residents die as a result of COVID-19. That is 19 more deaths from my press release that I put out on Friday, was the last time we reported. We are still tracking the 2 residents from Mississippi as out-of-state deaths. We have not had any other out-of-state deaths as a result, as of yet, to report. What I wanted to cover briefly this morning is just really say what have we learned about COVID-19? What have we learned about this virus? And what we know for sure is that the virus is affecting the most vulnerable part of our population, the elderly and the unhealthy. And when we say unhealthy, we're talking about folks that have comorbidities. We're seeing folks that have issues with hypertension, diabetes, lung disease, people with high cholesterol, people who are morbidly obese, suffer from obstructive sleep apnea. This part of the population seems to be most vulnerable as a result of its issues when it comes to COVID-19, as well as the elderly. The reason I say it's important for us to understand this is because what you have to understand is that this is the part of the population that needs to be protective. This is the part of the population that's protected by our stay-at-home, our social distancing, our physical distancing. And it's also the part of the population that we as citizens have a responsibility to in order to make sure they're cared for and taken care of. So as we begin, as the country, as the state, even as the parish begins to discuss folks and how we're going to reopen our economy and get back to what we would consider a normal way of life, what's very important is that we remember this vulnerable population. We remember the elderly. We remember the folks that are unhealthy and have these comorbidities so that we can protect them from potentially getting in trouble as a result of getting infected by COVID-19. Earlier, right before we started this Facebook Live press conference, we posted a graph on the Facebook page that I want to discuss now. This is basically looking at COVID-19 deaths by date. It goes back to our first death that occurred on March 21st, 2020, and it goes through this morning as of 10 a.m. And what you can see is that the number of deaths per day increased from 1 per day slowly up to a maximum of 9 per day. And we saw that spike on April 9th of 2020. Then there was a slight dip that occurred after that, and there was a second spike on April 17th, 2020, back to 9 deaths that day. I'm unsure why that exactly happened, why we saw a decrease and then an increase again. And it'll certainly take some more analysis for us to really figure out what's going on. But as of 4/20, what we're seeing is that we're down to 2 deaths per day. And we're hoping that that trend continues to 0. And so the next 5 days, when we look at the next 5 days of data on this graph, it's going to be incredibly important for us to track that, to see that those numbers move in the direction that we're hoping they move, which is down to 0. And then we'll see kind of the formulation of that bell-shaped curve. This is good information because what it also does is it allows the decision makers an opportunity to look at the science and the numbers when we make considerations of opening back up our social distancing, our physical distancing, our stay-at-home orders, and really the quarantine and how we can get back to an economy and a lifestyle that we were accustomed to previously. So we will keep this graph, updating it as the days go by. We'll probably republish it again on Friday of this week to see if there are any trends or things that we've learned in the next 5 days, with the hopes that the numbers do decrease daily. Having said that, I'm going to go ahead and try to take some of your questions and certainly watch them as they come across the screen. Again, if we miss a question, I apologize. We'll certainly try to get back to you and answer it after the Facebook Live session is over. So it talks about antibody testing. That's an excellent question. Yes, so I've heard that there are a few clinics and hospitals around town that are beginning to start their antibody testing. Why is that important? It's important to see if you've been exposed and or had COVID-19. Of course, if you do have antibodies, there's the high potential that you're now immune to the virus, meaning that you do not have the same risks as folks who are not immune. And so it will be interesting to see as we test people for the antibodies to the virus, how many folks in our community are now having that immunity. Of course, that'll be very important for our frontline workers because their risk of exposure to COVID-19 becomes a moot issue if they have immunity. So there's a question about how they do funerals for ones that have passed. That's an excellent question. We were given some guidance about 2 weeks ago from the Department of Health and the CDC that was really asking for families to make decisions within 3 days of whether they wanted to bury or cremate and to go ahead and have whatever services were going to be had at the point of 10 days. So it's kind of a 3-day, 10-day rule. Of course, they're still limiting the social gathering at these funerals, so no large funerals. I've even heard of some creative ways that people have conducted these where they wanted to have a visitation, and so they allowed families to drive past the funeral home for visitation purposes. They didn't get out the car, they didn't meet and congregate as a large group, but they came by one by one in order to pay their respects to the deceased and their families. So I think people are working through these problems as they are presented to us, and it's kind of what we have to do during this time is really assess the problem and work the problem to come up with a reasonable solution. There's a question about flattening the curve according to recent numbers. It does look like we are flattening the curve. When we look at the number of deaths in that graph, if you can look at it after I'm done talking, you'll see how the numbers are starting to slope downward. The next 5 days will be very crucial to see that those numbers continue in a downward progression. It has also been reported to us, and this is certainly something that we don't track directly as a coroner's office, but the number of people that are being hospitalized, the number of people that are being placed in the ICU, and the number of people that are being placed on ventilators has reduced as well. And so those are good indications that our quarantine and our social distancing, our physical distancing actually worked. So we're seeing less and less sick people. It's not to say people aren't still getting coronavirus, but it seems like the folks that maybe are getting it or getting COVID-19 are having cases that are not as severe, requiring hospitalization, ICU stay, or ventilation on a ventilator. All right, are there any other questions? All right, seeing that there are no other questions at this time, we're going to go ahead and sign off for today. We will be back next Monday at the same time with more to report. Also, look that we can look at forward to, we'll update that graph that I explained earlier and try to get the next 5 days worth of data into it so that we can all see what's happening with that progression. One last question I do see: what is the youngest person who's passed from this? We did have a COVID-related infant death due to prematurity that was reported about 2 or 3 weeks ago. The infant was not COVID positive, however, the mother was, and it was a direct result of her premature delivery. The youngest person who was swabbed positively for COVID-19 and passed as a result of it was 33 years old. This individual did have comorbidities, and those are the comorbidities that we spoke about earlier in the presentation today. So, having answered those questions, we appreciate it, and certainly you guys stay safe out there, and we'll be in touch. Thank you.